Great, thanks, Amy. Good afternoon. Thank you to all who are joining us for another session of our Workforce Collaborative Training Series. Today, we are very excited to have Elizabeth Leonard, LMHC, CASAC, and Senior Therapist at Horizon Therapy Associates with us for coping with grief and loss. A few quick reminders before we begin. At the end of this session, we will be asking you to complete a very brief evaluation. Please take a moment to fill this out so we can continue to improve our training series. Our next session will be Tuesday, September 23rd, and on LGBTQ+ inclusion and bias with Merrick Parker, MSW and Program Director at Best Self Homeless Services. The registration link is posted on our website and will be emailed out soon. We are continuing to fill our calendar for 2025 and are interested in hearing what topics and speakers you would like to hear from. So if you are interested in doing a 1-hour presentation, or if you're interested in a particular topic, please indicate that on your evaluation, or you can email Amy at amy.rockwood@erie.gov. The Erie County Department of Health is launching a learning collaborative that will begin in September, focused on substance use and harm reduction. Once that information has been released, we will be forwarding to all of you and would encourage you to sign up for these trainings as well. So look out for that information. The recording and slides from today's presentation will be posted to our website within the next few days. Just a reminder, the presentations and recordings from our past offerings are posted on our website as well. We have 5 years worth of amazing trainings posted. So if you have new staff, have them check this out. Or if you're looking for info on a particular topic, we probably have that too. So please look at our Training Collaborative website for all of our past offerings. Our training today is being recorded and everyone is muted. I'll be monitoring the chat during the presentation, so please place your questions in the chat and Elizabeth will be answering them as we go. And thank you again to all for joining us, and I'd like to introduce Elizabeth Leonard to talk with us on coping with grief and loss. Thank you so much for joining us, Elizabeth.
And thank you both for having me. I'm so excited to be here today to talk about a very difficult topic, grief, that I'm sure everyone can relate to both personally and professionally. So thank you again for having me. And I'm very excited to see how many different people and agencies are here today. So as introduced, I'm Elizabeth, and I am with Horizon Therapy Associates, which is the private practice of Horizon Health Services. So I've been with the company for a little over 11 years now, and I began my journey in our inpatient facility downtown at Terrace House. And so I had a lot of really good experience there within addiction work. And now being in Horizon Therapy Associates, my focus is more trauma, grief, and mental health. So I have my LMHC from Brooklyn College, and I'm EMDR certified as well, which is a trauma therapy, and a lot of background in trauma work and grief and loss as well. I like to say that grief found me. My personal experience has led me to specialize in this area. So I'm very excited to talk more about it and, again, get questions, input along the way. So let's start off with basics. What is grief? Grief is the response to a loss that contains our thoughts, our behaviors, emotions, physiological changes. If the loss is permanent, so too is the grief, but its form evolves and changes as the person adapts to the loss. Acute grief occurs in the early period after the loss, and it can dominate the life of a bereaved person with strong feelings of yearning, longing, sorrow, and insistent thoughts and memories of the person who died. Other painful emotions come along the way as well, including anxiety, anger, remorse, guilt, or shame. And oftentimes our activities are focused on doing or on not doing things to try to deal with the loss. So grief is really the internal response to a loss. And then mourning would be the outward or public expression of the grief and sorrow. And that can be shown through our behaviors, actions, rituals. And then bereavement would be the period of grief and mourning following the death. So all very similar, yet different in the internal, the external expression, and then bereavement being that time. And when you think bereavement period, you think about, days off of work, and think about that. It's often a very short amount of time, 3 days or 5 days, and then having to return back to normal when grief is anything but normal. So, they used to say the period of time would be 2 months of grief and then going back to normal. But the reality is there's no time limit. And I'll say that many times today, and it's different for every person. So bereavement would be that period. And then keep in mind as well, how we show our grief might be very different from how we feel it on the inside. So the grief and the mourning might not always align based on different factors like how we were raised, or what we learned on grief, or what our culture says, or what society says we should do. And so here's the stages of grief that many of you may have heard about from Elizabeth Kubler-Ross. So these stages, they don't go in this order. They can go in many different orders or back around in the cycle, but denial is often the first. This can't be happening. So shock, denial, right at the early time of the loss. And then anger, why did this happen? Or who's to blame? Anger is often secondary emotion to deep, deep pain that's primary. And sometimes anger, being able to blame, feels easier than having no answers at all or feeling that complete lack of control. And then bargaining, or the negotiation stage, is make this not happen, or I will, or, if I could change places with the person, or just kind of talking out, like making it change in some way. Depression, often I think, can last the longest of the stages, feeling I can't bear this, or functioning is affected, feeling down, and, deep, deep sadness and sorrow. And then finally, acceptance. So not acceptance of how the death happened or why it happened, but acknowledgement that it did happen. We cannot change it, and that, this is reality now versus before without my person. So the positives of theories in general, any theory, is that they give us some clarity during completely chaotic times. It helps us understand and have a little bit of direction, because with grief, there's no guidebook at all. Some of the negatives and criticisms of this theory or stages of grief is that there's only one healthy way to do it, that grief is universal, and that we should all fit into these neat little boxes and then move forward into each. But again, it's not linear whatsoever. So it might be going back into the stages many times, and that doesn't mean it's regression. Okay. So here's another diagram of Elizabeth Kubler-Ross's stages of moving through denial and other emotions that come with each stage. So avoidance, confusion, shock, fear. If you think about that denial, like trauma at the beginning of a loss, with it being so difficult and traumatic, it's like the brain's way of incorporating the information in a slow manner, because if it hit us all at once very quickly, that might be, we might not survive it. And then anger. So with anger comes frustration, irritation, and anxiety, lashing out, feeling overwhelmed. And then depression, low down. Again, we know what that looks like with helplessness, hopelessness. There might be anger there as well. And then coming up, bargaining, struggling to find meaning, reaching out to others, telling one's story. And then acceptance, accepting my reality, and then exploring new options and navigating what is life now. It says moving on, but I always say I do not use the words moving on. I say moving forward, because that's what we do. One foot in front of the other. It's not moving on in a way of forgetting or putting it behind us. And then another diagram. So the stages of grief, you again see many, many emotions that go down into that valley and then coming upward. And it looks neat and orderly on that side, but the reality is it's often the right-hand experience, a mess. It feels like a tangled ball going back and forth every which way. And that's how it is. You can have your loss can trigger previous losses, or other stressors of life that continue to happen can cause all these emotions to cycle through again and again. So, coming up into the new relationships, new strengths and patterns and hope, that's all, it sounds great. And, it gives us hope that we'll get there, but oftentimes it's a lot of the back and forth. So again, my points to take away today are that there's nothing abnormal in the grieving process, and that grief is not linear. You go through many stages and orders and many times. It's not regression. There is no time limit, and every griever grieves in their own way. There's no right way, and you're never wrong, and the work is never done. It's ongoing. It's something we learn to live with. And so just keeping in mind too, as human beings, we compare to each other. So making sure in grief that we're not comparing or judging the process of another person, or what you're feeling. A big piece of grief work is normalizing everything that comes with it. And so here's just a quote. Elizabeth Kubler-Ross said, "The reality is that you will grieve forever. You will not get over the loss of a loved one. You'll learn to live with it. You will heal and you will rebuild yourself around the loss you have suffered. You will be whole again, but you will never be the same, nor should you be the same, nor would you want to." And so I think that hits home. And a lot of times in doing identity work, we look at, how are we different now? And while that might be, cause mixed feelings that we're going to be different after, again, we wouldn't want to go back to the same as before because we're affected by loss. We grieve because we love deeply, and that doesn't go away. And so I just wanted to add this image of words. So these words are all parts of other theories of grief, other theorists. So I brought up Elizabeth Kubler-Ross because I'm sure many of us know her, but there's so many others. So John Bowlby, Colin Parks, Rando, Wolfelt, Warden, Niemeyer, and all the other theories use a lot of these words in their stages or their the way they look at moving through grief with like meaning making. So just notice the overlap in the words, a lot of R's: reinvesting, readjusting, embracing, accepting. So there's a lot to be said for theory, again, to give us guidance and help understand a very human reaction. So let's talk about different kinds of losses. There's many, many kinds. When we talk about grief and loss, we think death, with that being maybe the most difficult and obviously final and often very traumatic. So we grieve the death of human beings. We grieve humans that have lived long lives, and we grieve unborn miscarriages. We grieve animals and pets. And among loss, aside from death, we have these other things: relationships ending. I say often that can be sometimes equally as difficult to death because, one of the people in the relationship chose to end it, or for whatever reason it ended. The people are still here. So there might be questions left unanswered or unfinished business, or having to wonder, what is that person doing or who are they with? And it can bring up a lot of pain and suffering. We grieve our own identity at times, depending on if there's been change or, something that had happened. Physical health, we can grieve changes and illnesses and ailments that change who we are and how we function. Going along with that, independence, autonomy, loss of career or job, loss of normalcy. A lot of us went through that during the pandemic with losing complete normalcy, losing jobs, losing financial stability. We can lose our home. We can lose freedom, custody of children, drug of choice. It's important to make note of that because for many people that might use substances to cope, it is a coping skill. And while not the best one, it might have helped in ways and served purposes. And if a person chooses, or if others choose for them to no longer use that, it can be a grief experience. Grieving our dreams. What else? I think that's all on here, but there's other things as well. Grieving innocence. If anyone else has thoughts on kinds of losses that you've experienced or seen others experience, feel free to add it to the chat or chime in. But, again, there's many different kinds of loss we go through. And then going along with our primary loss, So whether it be someone passes or those losses I just mentioned come secondary losses. So in looking at the orange circles here, what comes with the loss? Might it be income or identity, dreams, faith, confidence, loss of the financial security or support system? There might be multiple secondary losses with losing a person. Losing a spouse could come with losing their side of the family or their friends. Again, the financial piece. So it can be like a domino effect, loss of dreams. So it's important to make note of that too, that while we have our primary grief, then there's these others that have to be attended to as well.
Elizabeth, we do have one person who chatted in. They found themselves grieving when their son was deployed in Iraq.
Absolutely. Yes. Thank you for sharing. That's a huge grief experience as well that comes with, the physical distance and knowing that'll be a longer term separation, along with the anxiety, the worry, and, potentially wondering, am I going to see them again? So that's, very good. Okay. And then going into different kinds of grief and loss. So there's a lot of different kinds as well. So we've got anticipatory grief, grief that occurs before the death. So this might be, what might happen with a chronic illness, or how this might play out, but we don't know when. And it's very, very stressful and anxiety provoking, the unknowns of planning for. So that can cause a lot of pain and suffering, especially for those that may be caregivers of someone who might be sick or dying. Anticipatory grief. Abbreviated grief would be grieving for a shorter amount of time, and that can sometimes follow anticipatory. So say if a person is ill and they're going to pass, a lot of the grief might happen before they pass. And so then it might be a shorter time or more abbreviated after the loss actually occurs. Sometimes I've heard people say that they're relieved if there was suffering, and that makes sense, right? But then there might be guilt that I feel relief. So a lot of emotion that comes from that. And then delayed grief is delayed. So it could happen months, days, weeks after the loss. That might occur if there's shock, a lot of initial shock, or if the grieving process is paused, which could be maybe, a caretaker that's planning services. They feel they have to hold everything together and, function well until after things are finished, or until I can make it through, and then I can grieve later. So that can be delayed. Inhibited grief would be emotions might be repressed, or maybe the person was never taught how to process. Inhibited, so it's not outwardly shown, and maybe not even felt in the same way on the inside. Cumulative grief is experiencing multiple losses simultaneously, and that can add a lot of complexity and challenges. So losing several people at once, that can bring up symptoms of trauma as well, or longer periods of shock. So very, very difficult. That could lead to more challenges in accepting or, moving through that, having to grieve each loss separately as well. And then ambiguous loss or grief occurs without closure or clear understanding. It often leaves a person searching. So for example, there's two kinds. You can have a person is physically absent, but psychologically present, such as a missing person. This can occur because of war, terrorism, natural disasters, deportation, genocide, loss of contact, divorce, adoption, estrangement, incarceration, or ghosting, which is a more current thing that occurs, a more current form of grief. And then second is psychologically absent, but with physical presence. For example, a person with Alzheimer's or dementia, or who has mental illness that makes them not the same person they were before, or potential brain injury. So they're physically still here, but mentally not the same. So that's a very difficult grief as well, right? With no clear closure, understanding, or we might not be able to grieve in the same way with that.
We do have a question that came in. This question is, what would grief that spurs the grief of something else that wasn't quite healed be called?
Um, that I actually don't know if that has a specific name, but it happens very, very commonly where, grief that happens now brings up other grief experiences, right, that weren't healed. Maybe then it was delayed or inhibited, but now it's coming out because of this current loss. It's so complex. So many things can contribute to this based on time, where are we now versus who we were then. Things are going to be different. There might be more support, or I feel like I can grieve the ones that I couldn't then. I'm not sure if that fully answers the question without more context, but it is a common occurrence.
Thank you.
And then, so collective grief would be, experiencing grief as a group potentially from war, natural disaster, terrorism, the pandemic. As I mentioned, we went through the pandemic together. And while we might think that collective grief is more comforting that we're in it together, sometimes it's not. It could feel isolating because, again, we grieve differently. Like trauma, right? Like the cumulative grief, we've all had different life experiences leading up to now. And so this can bring out, how we function through those different things can affect how we function now through it. Prolonged grief. So this is actually a newer diagnosis created in 2018 and added to the DSM-5 in 2022. Prolonged grief is diagnosed after a year post-loss, and these symptoms are very severe and get in the way of daily functioning. It's a more controversial topic, the fact that we're diagnosing a human condition and emotion. We typically don't diagnose grief, but I view this almost as like the PTSD of grief. Again, symptoms are very severe, getting in the way. So some of the benefits of having this diagnosis now are ability for people to seek treatment, having a name for it so we have more guided ways of taking care of it. So there are some benefits. Disenfranchised grief. This is what we call hidden grief. Occurs when the support system might invalidate the experience of the griever or make it insignificant. It might be something stigmatized, people not understanding the death or agreeing, deaths such as by suicide or homicide or overdose, drunk driving. Maybe the relationship itself wasn't validated. If it was an affair and no one else knew about it, how does that person then receive support? No one knew. So I posted a link here that has more resources on disenfranchised grief and also many different kinds so that people can gain understanding. Some additional kinds of disenfranchised grief that we go through. I mentioned grief of a pet. I say that that's a very real and valid loss. A pet's a part of the family, but a lot of people are told, oh, it's a pet, it's not a person, it's an animal, and they feel minimized by that. Grief, you can grieve people you've never met before, like online friends. A lot of people meet that way now. Sometimes we grieve celebrities. We didn't meet them as well, but in growing up with a celebrity and feeling connected and part of our culture, that can cause grief. It might be disenfranchised if the person was suffering or very old. A support group might say, well, they're in a better place now, or they're not suffering, but that invalidates our experience. So it does make us feel very alienated. It can bring up feelings of shame. So that's a very difficult experience. And then non-finite grief. This refers to grieving the life you expected. So it's like an unclear, we have goals, we have dreams related to our career or relationships or having kids, the American dream of getting married and having children. And sometimes our goals as children don't play out in that way. And we might grieve the dreams we had. And then we're left with this feeling of isolation as well, because maybe no one knew what those dreams were. So that's a difficult experience that can sometimes leave us feeling very alone. What can grief do? So take a look at that diagram, how it shows up in the body. And I think much like trauma, it can affect us head to toe. So tightness in the chest, shortness of breath, Immune system can be lowered, blood pressure higher, being more sensitive in general to noise or outside stimuli, feeling dizzy, dry mouth, sleep disturbances, change in eating, more or less extreme fatigue, headaches, inflammation, nausea, stomach pain, digestive issues, and just aches and pains. So the body holds trauma. The body holds grief. It can show up in many different ways. So important to connect that. Also, what I said before about if our internal experience doesn't match outwardly how we show or how we express, if we have more suppressed grief or emotion, sometimes the emotion can manifest as physical symptoms. So it can definitely take a toll, and I'm sure you notice that many of the symptoms here are symptoms of depression as well. So there is overlap. So what can grief do? It can lead to other mental health diagnoses, anxiety, depression. It makes sense. We can, have that long term. If depression or anxiety occurred before grief, sometimes they can be worsened after. It's important to make note, just for professionals here, that when diagnosing, when someone comes for mental health treatment, someone with grief is going to present with symptoms of depression, but that doesn't mean we diagnose depression. We have to look at context. And as I said, we don't diagnose grief. So oftentimes within agencies, we see people that have other diagnoses and other things that are easily diagnosed, but with a person coming in just with grief, again, unless it's prolonged, and that a year or more, we don't diagnose it. So we use the other unspecified trauma or stressor related disorder diagnosis. What else can grief do? It can cause withdrawal, isolation, relationship problems, loss of self-esteem or self-doubt, and then difficulty in daily functioning. So all areas are affected: concentration, memory, decision-making, completing tasks, difficulty at work, difficulty at school, you name it. It's very dysregulating. And as I said, with bereavement, and sometimes, we only get a few days off of work, or depending on our lives and what we have to do, we're expected to go back to normal functioning. And that's really tough. And I think times are changing a bit, where there's more time given sometimes, or more support within the workplace. I think that's really important. That what do people need in grief? They need time, they need support and flexibility. So whatever ways we can give that is important. And so suggestions for supporters of those with grief. This is really for anybody, for if you're supporting someone within your personal life, and of course professionally as well.
One question that did come in, if you have a minute.
Sure.
Would we use adjustment disorder as a diagnosis?
No, we do not use adjustment disorder. That may have been the case with DSM-4. I think it still was able to, but now it's specified it doesn't fall under adjustment. So it would be that other or unspecified stressor and trauma related. Okay. And just, yeah, the prolonged grief disorder, I'm just making note of, it took the place of the other codes for what we called complicated grief. Okay. All right. So if any of you have heard of Megan Devine, I think she's an excellent resource for grief. She wrote the book, It's Okay That You're Not Okay. So her website, Refuge in Grief, is excellent for helping through grief and helping supporters of grievers. Because again, society kind of says how we should do grief, and that it's often move through it quickly and get back to normal. And she really does a lot of work on explaining that's not how it works, and that we have to sit with grief and witness it. So she said each one of us has to find our way into that middle ground, a place that doesn't ask us to deny our grief and doesn't doom us forever, a place that honors the full breath of grief, which is really the full breath of love. So she's got some handouts on her website. The green box is from one of the handouts where she says, show up, listen, don't fix, just be with it. And then the links, so the top link is a short video on how to provide support. And again, just be with and validate the emotion and experience. And then the second YouTube video, we're not going to watch them now, but that's a popular one that many of you have seen, the Brené Brown, sympathy versus empathy, the difference between the two. And it's important to remember that with grief, we don't need sympathy, which feels more like pity. And that it kind of separates us on two separate levels, you know, the supporter looking down from above at the griever. Empathy is being able to see through the eyes of the griever and feel their feelings and just sit with them. Empathy often doesn't require words at all. It's just being with. So those are good videos. Some do's and don'ts. So these are on the website of David Kessler, one of my favorite grief theorists, and simple website grief.com. So he talks about the do's and don'ts of grief. So the best things to say to someone in grief, I'm sorry for your loss. Now that, I guess, is a controversial one because a lot of people don't like hearing that. That can be triggering, really, but you know, it's kind of like the norm of what we've been taught to say, and not necessarily I'm sorry for what happened, or you know, I'm involved in it. It's I'm sorry for the emotion, for the pain that you're experiencing. I wish I had the right words, just know that I care. So being able to say I don't have the words and I don't know how you feel, but I'm here to help you any way I can. You and your loved one will be in my thoughts and prayers. Sharing a favorite memory of the loved one. I'm always just a phone call away. So offering a hug or just being with, saying we all need help at times, I'm here for you. And then maybe offering specific ways you can help. And again, saying nothing and just being with the person. You have to know what their needs are, and a person might have to express those needs. They might not know in the moment what they need, but you know, the left-hand side definitely shows more empathy versus the right-hand side, the worst things to say. At least statements, at least she had a long life, or saying at least you still have one living parent. That's never helpful. That can be very invalidating. Saying they're in a better place, or they brought this on themselves, that would be a horrific thing to hear. Saying there's a reason for everything, you know, that's, while it could be true, a person's not able to see the reason in the thick of the pain and trauma of their loss. Saying, aren't you over them yet? You know, again, that's putting a time limit on it, and we never get over, we move forward. So you can see how this list feels invalidating and might make you cringe just looking at it. Saying, I know how you feel. Again, we never know each other's experience. We weren't there for it. We might understand from our own experience, but have to allow for that person to express it. And then telling someone, be strong. And then here's some traits of the best and worst for helpers. So the best traits are, again, being supportive, not trying to fix, being more about the feelings. It's a non-active approach, not directive or telling people what to do. Admitting they can't make it better. It's not asking for something or someone to change their feelings. It recognizes the loss, and again, not time limited. Versus the worst, which is the opposite here. So wanting to fix or make it go away, being uncomfortable about discomfort. You can tell sometimes when supporters feel uncomfortable with grief and want to kind of push it into the corner and don't really know what to do with that. It might be more directive in nature, or trying to rationalize, explain the loss, being judgmental or minimizing, putting a timeline on. So that's stuff that we would want to stay away from in supporting another with grief. And then individual grieving styles. Again, we all grieve very differently based on just personality factors, based on family upbringing, based on culture. So intuitive grief, Intuitive is experiencing grief with emotion. So the outward expression mirrors the inner feelings and emotions. It might be a person that's comfortable with tears, with sharing, showing. So it's more feeling than thinking. It's focused on exploring and expressing feelings and processing emotions. Stereotypically more common in women, but of course it can present with any gender and look differently, versus instrumental grief, which is experienced in a more physical way or cognitive way, so more logically. Grief might be expressed in that physical, cognitive, or behavioral way. People who are instrumental grievers might dive into a project or show grief through action, or that's how they help cope. It's more thinking than feeling. It's more intellectual or factual, focused on doing and actively responding, and oftentimes more how it's presented with men, but again, that doesn't have to be so.
A question that came in, and I think it came in maybe from the last slide.
Okay.
Can you elaborate on what you mean by not asking for something or someone to change feelings?
Let me just go back to that slide. Not asking for someone.
Or not asking for something or someone to change feelings.
So whatever feelings are presented with the grief, it's not changing that by trying to talk them out of that emotion, trying to say, well, you shouldn't feel that way. It's being able to sit with that feeling. So whatever it is, that's what we normalize versus trying to fix it or, change because we're uncomfortable with that emotion.
Thanks.
Okay. And so remember, as I said with grief and mourning, that, the intuitive and instrumental can be experienced both as well, where a person's internal, the way they feel the grief on the inside might be intuitive, but then they show it instrumentally. So it might not line up. Okay, grief in families. So that's a picture of a mobile above a baby's bed. So that represents, I use this image when talking about grief or trauma within a family, that if you were to take one piece off that mobile, it would imbalance the entire thing. And then, it would move around until it could balance itself back out. Grief does that. Grief unbalances a family. You take a person out and, the grief is going to affect everybody in a very different way. And then we grieve together as a family as well. So emotions might differ within the same family system. There might be different behaviors based on the family role. For example, the oldest sibling might take on the caregiver role if a parent dies, and then all the roles might shift. So that sibling steps in, and then the other siblings, their roles shift as well. So yes, it's like a domino effect where everybody might be grieving in response to each other's grief too. If a death changes one member, the whole system changes. And again, how we grieve might be based on what we learned within that family system, our values, norms, our religion, maybe what we learned from other children in school or, other people that helped raise us. So, and then grief across culture. So a quote from a grief theorist, Dr. Cacciatore. She says that grief is the single most unifying aspect of the human experience. Every culture and every religion knows about grief. So that's very true. And if you look at these images and how think about different grieving styles and traditions across culture. Oftentimes Western culture, black is worn, or some cultures might be more subdued where they cover their face or wipe their tears or don't show outwardly, versus cultures that look upward and cry out and are very expressive. Some cultures wear bright colors. So there's so many traditions, and we're going to talk about rituals in a couple minutes, but different grieving, beliefs and styles across culture. So It's important to learn, and doing work with patients, clients, customers that come to you. We need to ask questions and learn and, understand their experience culturally. Okay, so coping skills, tools, and rituals. And so in memorializing deceased loved ones, these are some common ideas or things that are done. Creative photo and message displays, so photo albums or, shadow boxes, so many different things that can be done with gathering memories. Memorial releases like balloons or lanterns or butterflies. Memorial jewelry or objects. A lot of people take comfort in taking items that belong to a loved one and making something out of it. Jewelry with the person's handwriting, or jewelry that holds ashes or a fingerprint, or taking clothing and making a t-shirt quilt or a pillow out of a shirt. So many creative ways. Letter writing can be done right to our loved one. Dinner party with a favorite meal of the loved one, inviting family, friends, planting a tree in their honor. I like the tree planting for people that may not have a burial site. It's a place you can go, you can watch it change with the seasons or with time, to feel connected. Donations or charities, ways of giving back, memorial stones, probably a lot of thoughts or ideas all of you might have as well. So those are just a few. And then creative interventions. So for those people that are more creative, personality-wise, creativity, art can be a really good outlet for grief, a way to do something, to feel, and then to have a finished product to remember by. So letters can be a creative outlet. Letters to self, from adult self to child self, or present self to future self, which is just like free written or prompted. That can help with a lot of emotions and processing and reflection. And then a loss box. So how might this be decorated? What's in it? This can be done in many ways too, where I've heard families will write notes as a family to their lost loved one and put it in the box, whether it be throughout the year or on a special date like a birthday or anniversary. That could be a good intervention for children. So children can add little mementos or things that, they want their loved one to know, and that can be a really special ritual. Family coat of arms, another good idea for children, of creating art on, our family crest, or what does our family mean? What's the value behind it? The grief spot, again, good for kids, but good for all ages. This is where you create an actual place within the home that you can put items for remembering, photos or books, or there can be comfort objects, blankets. And it's a good spot to go when you want to connect or think about your loved one, not in a way that feels like uncomfortable, but inviting, like that's where I want to go to connect with them. Grief ball, I like this for holidays or for any time of year, but for those that have Christmas trees or want to create ornaments, you can use the plastic clear ornaments that open up, and then use that to fill with messages for a loved one. And a good idea for kids when sometimes it's hard to express emotion. Different colored ribbons can be used to represent different emotions. So they could fill it with blue for sadness or yellow for joy, and choose how many to add. They could put pictures in there or anything really that means something to them to memorialize and hang up. And again, it can be any time of year or out on a memorial tree as well. And then linking objects, so memorializing with material possessions of the loved ones. Again, jewelry or something you can hold on to that make you feel connected, and that helps validate the relationship. It facilitates remembrance, and it encourages expression of feelings and represents the bereaved person and what the relationship meant to that person. And it helps manage separation anxiety as well. And then keeping positive memories alive is a very important piece as well, and way to cope. But it's helpful to be able to laugh and smile and have light memories to reflect back on. It can help those dark days feel lighter, and it definitely is helpful to direct back to positive moments when a loved one was at their healthiest or their strongest or looked like themselves. Because oftentimes, if depending on how we lost our person, if it was an illness that changed their appearance or something very traumatic, unfortunately, those last days stand out in our memory and can cause flashbacks or nightmares or trauma. And so we don't want to remember it that way. We want to, try to redirect back to those positive moments of, when they truly looked like them. And talking about them is very therapeutic. So being able to bring up the memories back to the best traits and what to do to help a loved one going through grief, bring up a happy memory. It's nice to be able to share that with each other and know, how your person was meaningful to everybody. And then this is David Kessler, as I mentioned. So he actually added on to Elizabeth Kubler-Ross's 5 stages, adding the 6th stage of grief, which is finding meaning. So just a quick background, David Kessler, he lost his mother when he was a young child, and while losing her, also witnessed a mass shooting, a terrorist event that really affected him. And from a young age, he decided to dedicate his life to grief work and helping first responders and others. And then later in life, he lost his 21-year-old son. So that really solidified his meaning for him. So he said, there's no greater gift than you can give someone in grief than to ask them about their loved one and then truly listen. And he said, this wasn't what my life was supposed to look like, but I faced a decision that everyone faces in grief. Is this just hideous, or can it be part of my son's legacy and meaning that he comes with me to so many cities to help people? So again, he's a good resource for just, his website has a lot of different things, a podcast on healing and working through those stages and normalizing emotion. But I caution you and I caution others, we don't want to push people towards that 6th stage too quickly. It's something they have to get to themselves. With some loss, we don't necessarily ever find meaning in it, but again, it's not meaning in the death, it's meaning in our life and what am I doing now? And a lot of people do go on to help others or create foundations that might help people that experience the same thing their loved one had. So there could be some form of good or growth that comes from it. And then moving on to rituals. Okay, this is a picture of a phone booth. I like the story behind this, that this phone booth was in the backyard of a man in Japan, and he had it there to cope with his own personal loss in 2010. And after the tsunami in 2011, somehow word spread that this was here and this was how he coped. And people started traveling from all over the country to the yard to speak to their loved one on what he called the wind phone and feel connection. So while, it's known we're not actually talking to our loved ones, it's a ritual that helps connect. It brings people together, and it's, doing something. It's something physical that can help us feel better. We have a lot of different rituals that are both personal and public, places we can visit. So we've got the 9/11 memorial. There's a mountain in Vermont that is for pet memorializing. A lot of people leave messages and notes on trees or in chapels. So you see it often, and it does help bring feelings of connection. So what do rituals do? They allow individuals to act. Again, it validates our physical and affective ventilation, so allowing to express. It gives a sense of control. It provides ongoing connection and allows space to safely confront feelings that might be ambivalent, confused. And then it generates social support. So rituals of continuity are doing something that acknowledge the continuing bond. So continuing a tradition like making their favorite meal. Rituals of transition might be affirming that they've entered a new place or transitioning to a new time. So such as a mom giving away personal belongings of a child. Rituals of reconciliation are asking for or extending forgiveness. Rituals of affirmation are a way to say thank you. And then rituals of intensification, it helps intensify connection among a group and reinforces a common identity like memorials.
We do have one comment that came in from the Western New York Compassion Connection, the Grief Support Center in Lancaster, and they're working on creating a phone booth so that people can speak with their loved ones as well.
Oh, that's great. Thank you so much. I've actually been talking about you guys and the services you now have because, you know, people are constantly seeking grief groups and supports, and sometimes it can be hard to find. So thank you. So additional rituals, flowers at the gravesite is commonly done, or decorating a place of death, you know, such as if there's a tragic car accident, you often see that at the site of the accident. Visiting a meaningful place. It's nice to think about what is a place I can go that I can connect with my person at. Vigils, and then these online memorial websites are nice because we use social media so often, and that, you know, Facebook or social media can be used for memorializing. That can often bring up a lot of pain for the family members or for people, but these websites are nice because they're there forever and they're a place you can visit to send messages and remember and have pictures. So it might feel like, you know, for some people that's a better option. All right, so the ball in the box analogy, you might have heard this before, and I really like it in explaining what grief is like. So grief, if you think there's a box with a ball in it, the box represents you, the grief is the ball, and there's a trigger button. So at the beginning, acute stage of grief, the ball is huge, the box is small, you shake up that box, and it's going to hit the trigger button all the time. And then as time goes by, not only does the ball shrink down, but the box, you, grow. So yes, you shake that up, it's still going to hit the trigger button, but not quite as often, or maybe more predictably, you know it's coming with like difficult dates, anniversaries, and etc. So smaller ball, bigger box. It never disappears completely. It's still going to be there, but again, you know, it shrinks to a point where it feels more manageable and doesn't hit that button as often. I think that's an important thing to note too, that while time does help, I often say time doesn't heal wounds. So, you know, it changes things. We look at things a little differently where we grieve more with love, less with pain. We can talk about it more. So it changes. This is a loving kindness meditation taken from Jack Kornfield. So he's got a website with many, many meditations, and he has one specific to grief that's much longer that you can find right on his website. But this is nice for words of affirmation. Some people have never heard this before or believed it, so I will give it out and have people read it out loud. May I be free from inner and outer harm and danger. May I be safe and protected. May I be free of mental suffering or distress. May I be happy. May I be free of physical pain and suffering. May I be healthy and strong. May I be able to live in this world happily, peacefully, joyfully, and with ease. So that can be helpful to do every day, just as a reminder. And then I'm sure many in the room know about box breathing. So that's where we breathe for 4, breathe in, hold for 4, exhale for 4, and then hold for 4, going in the shape of a box. So that can help to actually look at a box, look at your computer screen, look at your phone, look at a window, and be able to see that shape while you know, go upward, count, hold, you know, and it guides you. So just remembering to breathe is important. As I said, how dysregulating grief can be and overlap symptoms of trauma, and we often forget to breathe and feel that tightness in the chest and the lump in the throat, all the physical sensations that come. Just a few nice deep breaths can really have immediate effect. So a final quote for you: as far as I can see, grief will never truly end. It may become softer over time, more gentle, and some days will feel sharp, but grief will last as long as love does, forever. It's simply the way the absence of your loved one manifests in your heart, a deep longing accompanied by the deepest love. Some days the heavy fog may return, and the next day it may recede once again. It's all an ebb and a flow, a constant dance of sorrow and joy, pain and sweet love. I think that's so true, it comes in waves. So finally, just in talking about working with a grief counselor or a specialist, what are some benefits? Benefits can be identifying, expressing emotion, and validating those emotions, feeling affirmed. It's tough sometimes with, as I said, death being so final. It feels like there's no solution to my loss. They're not coming back, but just having someone sit with you and validate your experience can be very, very powerful. Someone can help you with relaxation techniques and, releasing the emotion or the sensation from the body that's being held. It can help with identity work, looking at who I was before, during, who am I now, who do I want to be, how does identity change? It helps with finding purpose and meaning in life when we feel so lost with no direction. It can help orchestrate social support, looking at who do I turn to for what. We all have supports in life, and we have to figure out compartmentalizing relationships. A therapist can be an open, very unbiased person to help give feedback, but just listen, versus family members who might give more directive or feedback that you need, tough love sometimes, We need all forms of support. We need someone to help us with physical tasks. We need people to distract us and just do fun things with us so life does feel normal. So helping figure out who do I go to, when, and for what. So obviously there's more bullet points we could list with how getting help could be helpful. But in finding help, obviously, I work for Horizon. So Horizon or other agencies in the area offer individual counseling or couples counseling or family, the ability to bring in multiple parties, group counseling. So I just listed our admissions department phone number, which is just the main hub for getting enrolled if treatment is wanted or needed. And then in finding private therapists, websites like Psychology Today or BetterHelp can be a good option as well, because sometimes it's nice to be able to see profiles or see if people specialize in grief or, obviously insurance, and just look at what's that counselor's background and knowledge or therapeutic style. So those are some ways of finding help. So that's everything I have to share, and I know we're just about at time, but I listed resources here, websites with information and good handouts and a lot of good stuff. So certainly if there's questions, I'll take them, and I believe all of you will get copies of this if you'd like. So thank you so much.
Yes, thank you so much, Elizabeth. Great presentation, so much information that we can all use. I think you touched on the questions as they came in, but I'm just going to look quickly to see if there's anything else. But in the meantime, Amy posted the link to our evaluation. So if you could just take a moment and fill that out, that would be great. She's also pasted links into the chat for our September session and our website, where the recording and slides from today's presentation will be posted within the next few days. Yes, and just a lot of thanks. Great presentations, very informative. So I don't see any other questions that have come in. Okay. But again, we want to thank you so much for your time and presenting to our group today.
Absolutely, and thank you again for having me.